Hello, everyone. I'll give folks some time to join. All right. So, hello, everyone, and welcome to tonight's debate for Maryland's 5th Congressional District. My name is Mckayla Wilkes, and I'm running to represent Maryland's 5th Congressional District in the United States House of Representatives. Tonight was supposed to be a debate between Congressman Hoyer and I, but after several of to have the congressman come on and debate his stances along with myself, he has not responded to our request. And so we are going to carry on this debate without. The reason for this debate was supposed to highlight the key differences between my policy and also Congressman Hoyer's policy as well. I'm going to tell you all a little bit about myself for those of you who are new. I grew up mainly in Maryland's 5th District in Charles County, and I spent the better part of my earlier years up until I was about 9 years old in Georges County. I'm running for Congress because for too long, regular people, working class people, have been overlooked, unseen, and ignored in the halls of Congress. I've been able to witness firsthand our system, our fixed criminal justice system, and our health insurance system because we don't have a healthcare system. Growing up, I suffered from traumatic stress after the loss of my aunt on November 11th. She was working and she lost her life. From that point on, I suffered from great traumatic stress and depression. And out of rebellion and out of dealing with the grief of losing her, it's my first time ever losing someone close to me. I was thrown in jail as a juvenile for truancy, for running away from home. And what I needed was someone to talk to. What I needed was someone to hear, but instead I was met with open arms through our justice system. It was at that time that I realized how horrible our criminal justice system was and how it was focused on incarceration versus rehabilitation at the young age of 14. And so I wanted psychology so that I can become a therapist and work inside of these institutions so that I can offer a sense of rehabilitation to those who are incarcerated. When I became an adult, I was also a survivor of the criminal justice system. I have been incarcerated for driving on a suspended license due to the inability to pay traffic tickets and court fines. I was living impoverished, minimum job to minimum wage job whenever I could find a job. And at the time, I was pregnant with my daughter, and the judge gave me an ultimatum of paying $1,000 in fines after I had expressed that my license was suspended because I couldn't afford traffic, or I could do 2 nights in jail. Pregnant with my daughter, a high-risk pregnancy, I took the 2 nights in jail because I did not have the money to pay to stay out of jail. That same year, 2014, is when I was diagnosed with deep fibrosis, which is just that your blood clots. I suffered from a pulmonary embolism. I had a blood clot behind each knee, and I was told by my team of doctors that my health going to pay for the life-saving medications that I needed. And so I was admitted to the hospital for 2 weeks while waiting for, while watching my doctors argue and haggle with the health insurance companies to get them to pay for my medication, in which my life-saving medication cost almost $30,000 for a month supply. So there was no way I was going to be able to pay for that. But 2014 was a pivotal year for me. It was the moment that I realized that I become politically engaged. It was the moment I realized that these issues were not individual issues, but that these were systemic issues that needed systemic solutions in order to help people in our community so that stories like mine are no longer possible. And that's when I decided science, and that's when I started to look into representative. I started to look into the legislation that allowed these things to happen. And I decided that one day I would run for Congress, because why not someone who's been through it and actually cares? Why not have someone like that represent us, is going to take issues personally and that are going to fight for us personally? Someone that understands how policy affects people and cares. But of course, someone with my background, having been incarcerated, having not finished college yet, at the time, a single mom, someone like me doesn't run for Congress. And so I kind of held back and waited until I could check off the checklist of what it means to be a politician. I thought I needed to intern on the or start school governors. Until 2018 came, which was definitely a life changer when I saw regular people running for Congress all over the country. But I saw one person in particular that hated. It was Alexandria Ocasio-Cortez. And that's when I realized if she can run as a regular person on the same issues that I care about, then I don't have to wait my turn. I can run now. And I did run for Congress and put my name to represent Maryland's 5th Congressional District in February of 2019. And so here we are today. So that is why I decided to run for Congress, and a little bit of background on myself. I will move into questions that I had planned to ask Congressman Hoyer, and also for myself to answer as well. So the two questions that I have, the first one is, Congressman Hoyer, what are your biggest policy priorities? And I will give the congressman some time to answer. Well, since Congressman Hoyer is not answering the question, and he's not here to answer the question, I will answer the question myself. My biggest policy priority for housing, Medicare for all, improved Medicare for all, universal health care, a Green New Deal to overhaul the public transportation system in our district, to bring jobs to our district, to bring green infrastructure to our district, and to bring us 2% generations to come. It is also a transformative criminal justice reform that is actually going to focus on restorative justice and rehabilitation. It is going to be an actual justice system that criminalizes people for being impoverished, that doesn't criminalize mental health illness, and that doesn't criminalize substance abuse addiction. It is also public education and increasing the funding that we put in our public education systems, because the way that our schools are funded is completely inequitable. The way that our schools are funded are highly off of property taxes, which some areas have a higher income of property taxes than others, which leaves their schools underfunded. And we also need to make sure that we are working with counties and municipalities to ensure that teachers are getting a salary no less than $60,000 a year. And those are my top priorities. The next question I will ask Congressman Hoyer. How would you make yourself accessible to your constituents? And I will give the congressman time to answer the question. Well, since the congressman is not here to answer the question, I will answer the question on my behalf. I will make myself accessible to constituents by continuously holding in-person town halls, as well as teletown halls and virtual ones for those who may not be able to make it in person. And I would do this on a regular basis. I want to hold roundtable discussions with community organizers, with people in the district. I want to include constituents like myself who have for so long felt they haven't been heard. I want to include everyone in the conversation. And I won't just pawn them off and ignore them like so many of us have been in the past, because that time is over. Now, I will move my questions over to specific questions that I have for Congressman Hoyer. Should he have been here tonight, he would have been able to answer these questions and to defend his record. But since the congressman chose not to be included in this debate, since he chose not to show up to speak about his stances, I'm going to let you all know the questions that I'm going to ask Congressman Hoyer. So here we go. Congressman Hoyer, millions of people just lost their health care because they lost their jobs due to a pandemic. Why do you still support an employer-based health insurance system instead of a single-payer system? And is it related to the fact that your campaign has taken over $1 million from the pharmaceutical industry and private health insurance companies? And I will let Congressman Hoyer take some time to answer that question. Well, Congressman Hoyer does not want to answer. My other question for the congressman, Congressman Hoyer, you voted for the crime bills that were passed in 1982, 1984, 1986, 1988, and 1994, all of which contributed to the creation of the mass incarceration and the devastating war on drugs. Just last year, you referred to marijuana as a threshold drug, aka a gateway drug, when citing your opposition to its legalization. What will you do to reverse the harm that the war on drugs has caused, and what will you do to end mass incarceration? And I will let the congressman answer. Well, Congressman Hoyer doesn't want to answer the question, so I will answer the question of how we will do these things. For one, we are going to decriminalize the usage and possession of all drugs to ensure that folks are not being incarcerated because they suffer from substance abuse addiction. In addition to that, we are going to enact a universal healthcare system so that everyone can get the mental health care that they need, so that they can get the treatment that they need versus jail time, which is what they don't need. What we are going to do is end the cash bail system that allows people to sit in jail because they can't afford to get out, because our freedom shouldn't depend on if we can pay for it or not. The majority of people who are incarcerated are there because of the cash bail system, because they cannot afford their freedom. Question number 3. Congressman Hoyer, you opposed the Green New Deal. Your campaign has taken over $1 million from the fossil fuel industry. My final question for you is this. as the majority leader of the House of Representatives and the dean of the Maryland Congressional Delegation, why aren't you leading on the issue of climate change? And I will give the congressman time to answer that question. Well, the congressman is not answering the question. And so those are my questions for the congressman. I will open the floor up to Congressman Hoyer for him to ask any questions of me he would like to ask. Congressman Hoyer, please list your questions to me and I will be more than thrilled to answer them. So the congressman doesn't have any questions for me. So since the congressman does not have any questions for me, I will open the questions. I will open the floor up to those of you who are watching. If any of you all would like to ask a question, I will be taking questions from the audience. And as a matter of fact, I'm going to scroll up because I think I may have seen a few questions at the top, but let me see. Since Congressman Hoyer so delightfully does not have any questions tonight. Okay, let's go back down to the bottom. All right, so here's this question. What is your stance on nuclear energy? I do not support nuclear energy. I think that we need to move to a more productive way of reaching 100% renewable energy instead of another source that is going to cause another set of problems. Joe Kirchner says, what would you do to reform? What would you reform of the tax system? The biggest thing that I would do to reform the tax system is to ensure that everyone pays their fair share in taxes, meaning regular people like us won't get stuck with having the burden of taxation on us, but rather the wealthy people pay their fair share in taxes, because there is no conscionable reason why someone like me or someone like any of us who is on this thread right now are paying more taxes than Jeff Bezos, who is set to be the world's first trillionaire. Not only did Jeff Bezos not have to pay anything in taxes last year, in addition to making $11 billion in profit, but he actually got an income tax back from the government. Okay. All right. All right. So Stephen Jackson Lees asked, could you talk about your plan for funding a UBI through a social wealth fund? All right. So universal basic income is similar to what we're seeing now with the stimulus checks, except they would be either periodically or a one-time payment per year. And how it works is how we fund it is initially funding it through taxes on wealth, taxes on extremely wealthy estates, taxes on financial transactions, and low interest government borrowing. So essentially, we are going to democratize the stock market. because right now the ultra wealthy owns about, the top 1% owns about 38% of the stock market. And so this social wealth fund tax would essentially radically democratize stock market ownership while also increasing every adult American's income by several $1,000s each year. So what happens is the federal government buys up stocks and bonds and other financial assets and manages them through an investment fund. And so every American adult would be a stakeholder in this. And you would get and each year, 5% of its value would be paid out to stakeholders in the form of an equal dividend. So as the fund grows each year, so does the annual payout. And the payout doesn't necessarily have to be annual. It could also work out as monthly as well. Oh, this is a good question. Let me scroll up. So Brandon Russell asked, how would you work with party leadership like Pelosi or Biden? Oops, sorry, you guys are asking so many questions. Hold on, I gotta go back up to it. Or actually, I can do this. Bam. How would you work with party leadership like Pelosi or Biden to push a more liberal agenda? What I would do is organize on the federal level. And I think that is one of the advantages of having someone who is an activist and an organizer become an elected official, because we organize and we activate on the ground, and we can organize and activate and build coalitions within Congress. I don't like the current political climate where it is currently progressives against the establishment Democrats and then all the Democrats against the Republicans. I think that we need to work together to build coalitions in order to pass progressive legislation, because we can't do anything as one person when you're in Congress. As much as, elected officials fight for their districts, but it all has to come down to everyone being on the same page, or the majority being on the same page. And that's why we need to build coalitions and organize on the federal level to ensure that we're passing legislation instead of just consistently bumping heads because we don't have the same views. But we need to work together to make sure that things are done in the best interest of our district. All right. Okay. Oh, Dash asked, how can people get involved with the campaign? So if folks want to get involved with the campaign, which I completely encourage people to do, we only have a few days left. Next Tuesday will be it. Next Tuesday will be it. And we phone bank every single day. We have multiple phone banking shifts. And so if anyone would like to help out, definitely go to our website at Mckayla2020.com. Click the volunteer tab. If speaking to strangers isn't your thing, because we do speak to a lot of people in the district, then I would also encourage you to make a donation to the campaign as well at Mckayla2020.com and hit the donation tab. And we are a grassroots campaign, so our average contribution is roughly $20. So anything counts. Everything counts. Okay. Sorry, guys, my comments are going crazy. Okay, here's a question. Will you vote for reparations, and what is your plan for them? So yes, I do support reparations. I know there's a bill out, HR 40. Completely support the bill, completely support it. It's about investing in the study of reparations. But let's be honest, the studies have already been done. It's just time to implement reparations for those African descendants of slaves. And how we're going to do that is invest into communities that the war on drugs has negatively impacted, specifically Black and Brown communities. We are also going to invest, in our public schools and our HBCUs. I also support affirmative action specifically for African descendants of slaves as a part of reparations as well. I am also in favor of, as we say, cutting the check as well. But I think that the most important thing that we can do with reparations is uplift our communities and further advance the lives of Black people. And also institute systemic reparations as well, like reforming our criminal justice system, overhauling our political system, to be honest, to get rid of systemic oppression. Jeff asks, will you work to grant statehood to DC? Absolutely. There's no question about that. I absolutely would. Jasmine Britt asks, what would be your first order of business once you get in, namely your main priority on day one? So what I'm really big on is campaign finance reform. I really want to get in and start to work on reforming the way that we fund our political campaigns to ensure that we get the dark money out of politics. I think it's something that can be passed. A lot of Democrats now in the House support repealing Citizens United. Another piece of policy that I absolutely want to pass is to fully fund our Section 8 program, which would only cost $40 billion. And in federal money, $40 billion is not that much money. And fully funding the Section 8 program would essentially end homelessness, because the thing is, currently, only 1 out of 4 people that need Section 8 assistance actually gets it, which leaves everyone else, about 75% of people, left without the housing assistance they need, therefore leading to more homelessness in our communities. It's also the reason for very long wait times. Some people are on the Section 8 list for years before their names even get called, over 10 years. And so fully funding the Section 8 program would also get rid of the long wait times and essentially give everyone the housing assistance that they need. Okay, another question. My quote for facial feminization surgery is $29,000, and for bottom surgery, it's $25,000. For many people, this is our entire salary. For many people, this is our entire salary. How do you plan to make transitional surgeries more affordable? I plan to make transitional surgeries more affordable by covering them under the universal healthcare system by way of Medicare for all. So it will eliminate all out-of-pocket costs. Carlos asks, what will you do to help Black Americans be able to take part in the marijuana industry once it is legalized, especially given that most people involved in the medical marijuana, especially given that most people involved in medical marijuana are white Americans? Thank you. Well, I want to ensure that we have a definite percentage of Black Americans that are able to take part in the marijuana industry for the exact reason that you said. I definitely want to push harder for Black businesses, period, small Black-owned businesses, period. And I want that to also include the marijuana industry. And hopefully, when we do legalize it, it'll be the medical marijuana industry and the recreational marijuana industry. Michael Hartman says, Mckayla, how do you keep up with spirits when confronted with such a disrespectful opponent? How I keep my spirits up is I just keep fighting. Every day is a fight. I mean, we have a few days left and we say we're going to win every day. And how I deal with it and keep my spirits up is win every single day. We won yesterday. We won today. We're going to win tomorrow. And we're going to keep winning until June 2nd. Let me see if I have any other questions. Okay, my comments are going crazy. I will do 2 more questions, about 2 or 3 more questions. Okay, so Taylor West asked, what is your stance on abolishing ICE? We should absolutely abolish ICE. ICE is a fairly new organization. It's not needed, and it's essentially just another police force. And I'm not in favor of having more policing. I think that, especially in light of recent events, we should definitely not be creating new any type of police forces. We should be looking at a clear pathway to citizenship instead of a clear pathway to incarceration or deportation. Okay, and Dash asks, can you talk about, okay, my comments. Y'all are killing it with the comments. Love it. All right, Dash asks, can you talk about whether you support open primaries and ranked choice voting? I absolutely support open primaries. I think having our primaries closed is a form of voter suppression. For example, we had a supporter reach out to us today stating that their family member was registered as an independent, even though they were never registered as an independent. They were registered as a Democrat. And for that reason, they were not able to vote in the Democratic primary. If we can open up our primaries, then everyone can vote. Regardless of party affiliation, you can choose whatever candidates you would like to choose. In regards to ranked choice voting, I absolutely support ranked choice voting because that gives the people more choice in who they would like to represent them versus just a clear majority vote for one person or the other person. We always want to expand voter rights, and we always want to make sure that people can be as politically engaged as they possibly want to, which is why open primaries and ranked choice voting is definitely the way to go and something that I absolutely support. And it's also included in our platform as well. Okay. Danielle Fluker has asked me to do more research on nuclear energy. I definitely will do more research. I'm willing to compromise as long as we can get to 100% renewable energy in the time frame that we need to be in order to be resilient. And because I do want to be a representative that includes the voice of people in our communities, then I definitely want to make sure that is what we're doing, that we are including people into the conversations that we are having. And so I will definitely do more research into that as well. Okay, so Chrissy Keene Holt says Hoyer sent out another mailer about the Affordable Care Act. He has, sorry, ooh, you guys are going crazy with the comments. Let me just do this. Okay, need glasses. Hoyer sent another email about the ACA. Has he or Congress done anything to help us in the pandemic? Please discuss Medicare for all. Okay, so we're going to talk about this. Sorry, guys. had a leg cramp. So we're going to talk about this. So what Congress has done in regards to helping people get the health care that they need during this pandemic. So let's talk about the CARES Act, where they didn't expand coverage to anyone. But then let's talk about the HEROES Act, which just passed, where they had an opportunity to pass a bill that would have expanded Medicare services to all that have lost their employment. And the reason for that is because our insurance is tied to our employment. And so essentially, when they lose their jobs, you lose your health insurance. So what they are fighting to do in the CARES Act, in the HEROES Act, is to fully fund COBRA. For those who may not be familiar, COBRA is basically what you pay. Like if you left the job and you want to keep the insurance that you're paying, if you want to keep the insurance that you currently have, then you just pay the full price after your employment. But technically you're already paying the full price, because even though your employer frames it as they pay a portion, no, they don't. A portion comes out of your salary. And so they pay you they pay your health insurance based off of what they think they can take from your salary. So it's just another addition of your salary. So what they want to do is fully fund COBRA. By fully funding COBRA, it's basically writing a big check to insurance companies to fully fund that, when they could have expanded Medicare services to everyone that lost their jobs and their employer-based health insurance, because it would virtually cost the government nothing. But instead of saving money, and instead of making sure that people had health care, they once again bailed out the insurance companies, as they always do. And please discuss Medicare for all. So a lot of people have questions about Medicare for all and what it actually is. So Medicare for all is a single payer system. It's universal health care, meaning that every single person will get health care. Universal health care does get rid of private insurance, but you get to keep your doctor. It opens up a plethora of choices, you guys. You can see whatever doctor you need to see. You don't have to have a referral to go to see specialists. It eliminates all out-of-pocket costs at the point of service. And it saves everyone loads of money, and you can't be denied care. Medicare for all also covers dental, vision, and mental health care as well, all coupled into one, because as our current health insurance system is, those things are separate, and you have to have one insurance policy for dental, one insurance policy for vision, one insurance policy for primary care. But under Medicare for all of these things are coupled together. Also under Medicare for all, prescription drug prices will be capped at $200. No more price gouging life-saving medications, like how my medication was price gouged to be almost $30,000 for a freaking 30-day supply. No more people dying at the age of 26 because they have diabetes and they're kicked off of their parents' health insurance. Do you know that there is actually a high death rate for adults that are 26 years old because the cutoff age to be on your parents' insurance is 25? That's the current system that we have. That's the current system that Steny Hoyer is fighting to maintain. And he always likes to use buzzwords. I support access to health care. We already have access to health care. We need health care. That's it. But yes, Medicare for all saves lives. 45,000 people die each year from not having health insurance. And that doesn't even cover the folks who are underinsured, paying hundreds of dollars a month for health care like I was, and still being able to be denied health care by their health insurance companies. I wish we were in a room, because I would ask everyone, how many times have your doctor prescribed you a medication and your insurance company said, oh, we don't cover that. We need Medicare for all. And I will take one more question. Yeah, Erica says we all have access to buy a mansion too, but that doesn't mean we can. Exactly. It's completely barbaric. Okay, so Cece asks, do you support Planned Parenthood and fully funded abortions? I absolutely do support Planned Parenthood. I am a patient of Planned Parenthood. I go there to receive health care, and abortions are health care. And I definitely support abortions being covered as well under Medicare for All, because it's a woman's right to choose. And I don't think that we should be enforcing any other kinds of roadblocks to keep women from getting health care. I don't understand why there is a somewhat of a difference of, you know, the healthcare that women receive and the healthcare of everyone else. Women's care is healthcare, period. I don't care what it is that we do with our bodies. It's healthcare for us. And I'm just tired of the government trying to police our bodies by making it further inaccessible and unaffordable for us to get healthcare for ourselves, including birth control. All right. All right. That is going to be it for our questions tonight. I really wish that Congressman Hoyer would have came and joined this conversation. You all are amazing for being here. I appreciate each and every one of you for tuning in. It is a complete disservice for a sitting congressman to not engage in a debate or even a forum to defend his stances to the people of his constituency. It's a complete disservice. I also would have liked to ask Congressman Hoyer what his housing plan is. Did you know that Steny Hoyer does not have any kind of housing policy whatsoever on his website? A sitting member of Congress that has been in Congress for almost 40 years does not have a plan to end homelessness, does not have a plan to put people in homes. We have 10 cities. We have folks who are homeless that are stuck on disability because they are forced to live impoverished, live in poverty, because should you try to get a job to supplement your income while you're on disability, it disqualifies you from benefits. Congressman Hoyer, speaking of benefits and speaking of Social Security, Congressman Hoyer put Social Security cuts on the table in order to pass fiscal budget. He would have cut your Social Security to pass a fiscal budget, but doesn't blink an eye at passing the defense budget every single year. And we just passed the highest defense budget in history. Part of that could have ended homelessness. Part of that could have paid everyone's college tuition. Part of it could have paid for Medicare for all. But no, it went to the defense industry because our politicians take corporate money and they take donations from Boeing, from Raytheon. But sorry, I got a little bit hot. But yeah, again, thanks everyone for joining in. If anyone would like to be involved with the campaign, help us to make history. We phone bank every single day. The phone banking shifts are so fun. It's so hype. We have our little hype up calls before so we can talk. We do offer training as well if you've never phone banked before. Like I said before, if speaking with strangers is not your thing, please consider making a contribution to our campaign. We are grassroots, which means that we are people funded, and we're a race of people versus money, but we still need money. At the same time, our average contribution is $20, like around $20. So anything helps, whether it's $1, whether it's $5, whether it's 10, whether it's 20, or you can max out and give us $2,800 to help us out in these last days. You can do both of those things by going to Mckayla2020.com and either hitting the volunteer tab or the donate tab. Also, Emily has just dropped a few links down in the comment section if you would like to get involved. If I didn't get to answer a question that you had tonight, or if you are watching this after it has gone live, please don't hesitate to send us an inbox on Facebook. I'm completely accessible. I answer my own Facebook messages most of the time. And also, don't hesitate to send us an email. My email address is info@Mckayla2020.com. And that email address like really just goes to like me and one other person. So I'll for sure get it. But I want to just thank you all again for tuning in and for joining this conversation. And I just want to leave a message with you all to take care and be safe and stay home if you can. And yeah, we're going to win this. All right, guys. Bye.